Chapter 26, Informatics and Documentation. Documentation is key for communication because it produces a written account of patient data, clinical decisions and interventions, and patient responses in a healthcare record. Documentation in a patient's health record is a vital aspect of the nursing practice. Nursing documentation systems reflect current standards of nursing practice and minimize the risk of errors. Quality of care, the standards of regulatory agencies and nursing practice, the reimbursement structure in a healthcare system, and legal guidelines make documentation and reporting an extremely important nursing responsibility. Document all the nursing care provided for each patient, including assessment data, nursing problems or diagnoses, interventions, and evaluation of patient responses in the health record. Data is used to audit, monitor, and evaluate the care provided to support the process needed for quality and performance improvement. There are privacy and ethical considerations to address when accessing healthcare information and when health records serve as resources for nursing and healthcare education and for research data. The record is one resource that prepares the healthcare provider to know a patient thoroughly so that timely and appropriate care decisions can be made. All health records contain the following information: patient identification and demographic data, existence of a living will or durable power of attorney for healthcare documents, informed consent for treatments and procedures, admission data, nursing diagnoses or problems and the nursing or interprofessional care plan, record of nursing care treatment and evaluation, medical history, medical diagnoses, therapeutic orders, considering the code status, medical and interprofessional progress notes, physical assessment findings, diagnostic study results, patient education, summary of operative procedures, and discharge summary and plan. There are legal guidelines for documentation. We do not document retaliatory or critical comments about a patient or another care provider by any health professional. We do not provide personal opinions. Statements that are made in the medical record can be used as evidence for non-professional behavior or poor quality care. We correct all errors promptly. Record only the facts. The record must be accurate, factual, and objective, and we need to be certain that each entry is thorough. Anyone that reads the documentation needs to be able to determine that a patient received adequate care. We document discussions with providers that are initiated to seek clarification regarding an order that is questionable. We only document for ourselves. We never enter documentation for someone else. The only exception is if a caregiver has left the unit for the day and calls with information that needs to be documented. If this is the case, we include the date and time of the entry and reference the specific date and time to which we are referring to, as well as the name of the source of the information in the entry, and we include that information was provided via telephone. We avoid using generalized empty phrases such as status unchanged or had a good day. These are gray words that have no meaning in medical terminology. We use complete, concise descriptions of assessments and care provided so that the documentation is objective and factual. We begin each entry with the date and time, and we end with our signature and our credentials. This ensures that the correct sequence of events is recorded. The signature for the documentation is who is accountable for the care that was delivered. We protect the security of our password for computerized documentation. This helps maintain security and confidentiality of patient health records. There are guidelines that are specific to written documentation. We never erase or scratch out errors that are made, because charting will become illegible and it will appear as if we were trying to hide information or deface a written document. If it is written, we draw a single line through the error and write the word error above it. We sign our name or our initials and we date it. Then we record the note correctly. We do not leave any blank spaces or lines in a written nursing progress note. We chart consecutively, line by line. If a space is left, we draw a line horizontally through it, and we place our name and our credentials at the end. We record all written entries legibly using black ink only. We do not use pencils, felt tip pens, or erasable ink. Health Information Technology for Economic and Clinical Health Act, or HITECH, has been a major driver in the adoption as well as the use of electronic health records throughout the United States. Meaningful use requires the use of an electronic health record system that results in improved quality, safety, and efficacy of healthcare. It increases healthcare consumers' active involvement in their own care. It increases coordination of healthcare delivery. It advances public health, and it safeguards the privacy and the security of personal health records. The electronic health record has become the favored item for an individual's lifetime computerized record. It means both the displayed or the printed record. The acronym EHRS indicates the supporting software system. The electronic medical record refers to a patient's record within an integrated healthcare information system for an individual visit to a healthcare provider's office or for an individual admission to an acute care setting. This allows for seamless documentation of the progression of care. Nurses are legally and ethically obligated to keep information about patients confidential. The Health Insurance Portability and Accountability Act of 1996 was the first federal legislation to provide protection for patient records. This governs all areas of patient information and management of the information. HIPAA requires healthcare providers to notify patients of privacy policies and to obtain written acknowledgement from patients indicating they have received this information. Information regarding a patient's health status may not be released to non-healthcare team members because legal and ethical obligations require healthcare providers to keep information strictly confidential. Regulations require healthcare institutions to document evidence of physical and emotional well-being. Reimbursement issues related to patient care and procedures may be of concern. Fragmentation of nursing and medical care procedures may be identified. The answer is A. Under the HIPAA laws, a patient's medical information may only be released to team members unless expressed written consent is provided by the patient. There are legal implications associated with the use of electronic documentation. Under HIPAA, Ensuring appropriate access to and confidentiality of personal health information, or PHI, is the responsibility of anyone that works within the healthcare system. Personal health information is individually identifiable relating to an individual's past, present, or future health status that is created, collected, transmitted, or maintained by a HIPAA-covered entity in relation to the provision of health care, payment for healthcare services, or use in healthcare operations. The protection of information and computer system is a top priority in healthcare. It is essential to guard any information that is printed from the record or extracted for report purposes. Nursing students should not print information from the health record to take from the clinical agency to complete written assignments for their clinical. All patient data must be de-identified when transcribed onto forms or used for academic papers for clinical courses in nursing school. Any information that is transcribed and must be removed from the clinical setting, and any documents that must be printed out must be kept secure and destroyed by shredding or disposal in a locked receptacle as soon as possible. Current documentation standards require that all individuals admitted to a healthcare facility be assessed for physical, psychosocial, environmental, self-care, spiritual, cultural, knowledge level, and discharge planning needs. Documentation needs to demonstrate the application of the nursing process, describe clinical decision-making, and include evidence of patient and family teaching, as well as discharge planning. In the medical profession, we use the 24-hour military time to provide care. That way, no AM or PM is used, and it can never be mistaken for the time of the initiative that we have taken. Factual record contains clear, descriptive, objective information about what a nurse observes, hears, palpates, or smells. We avoid vague terms or gray terms such as appears, seems, or apparently. The only subjective data included in the health record are statements made by a patient. When recording subjective data, we document a patient's exact words within quotation marks whenever possible. Accuracy. We use exact measurements to establish accuracy and help determine whether a patient's condition has changed in a positive or a negative way. Documentation of concise data is clear and easy to understand. For current, timely entries are essential in a patient's care because delays in documentation can lead to unsafe patient care. The documentation of the following activity or findings need to occur at the time they were instituted. These would be vital signs, pain assessment, administration of medications or treatments, preparation for diagnostic tests or surgery, including the preoperative checklist, a change in the patient's status, treatment provided, as well as who was notified, the admission, transfer, discharge, or death of a patient, the patient's response to a treatment or an intervention. For organized, the documentation is more effective when the notes are concise, clear, and to the point, and presented in a logical order. Complete. Nurses are assured the information within the recorded entry or the report is complete and contains appropriate and essential information. When reading this case study, what would you take for your first step when you hear the patient report pain as 10 out of 10? What would you record in the chart for Mrs. Smith? What type of data is provided by Mrs. Smith's statement? And how would you record her statement in the report? A nurse has just admitted a patient with a medical diagnosis of congestive heart failure. When completing the admission paperwork, the nurse needs to record an interpretation of patient behavior, objective data that are observed, lengthy entry using lay terminology, abbreviations familiar to the nurse. The answer is B. Objective data are part of the assessment portion of the nursing process. All data collected during the nursing process should be documented. Nurses routinely document patient physiologic data and routine care using flow sheets. These forms allow quick and easy entering of assessment data about a patient, considering vital signs, admission, daily weights, or percentage of meals eaten. Healthcare team members will monitor and record the progress made toward resolving the patient's problems in the progress notes. Healthcare providers write narrative notes in one of several formats or structured notes within the electronic health record. Notes may take the form of traditional narrative documentation or make use of more precise formats such as focus charting, incorporating data, action, and response, or DAR. Number 2, SOAP notes, which identify interprofessional problems. Or 3, notes with a specific nursing focus, identifying nursing problems or diagnoses, as in pie charting. Narrative documentation is the format traditionally used by nurses and healthcare providers to record patient assessment, clinical decisions, and care provided. It consists of a story-like format to document information. Charting by exception, this is where all standards for normal assessment findings or for routine care activities are met unless otherwise documented. Exception-based documentation systems incorporate standards of care and use clearly predefined statements for nursing documentation of normal body system findings. These normal findings are defined as within defined limits or within normal limits, and they consist of written criteria for a normal assessment for each body system. A nurse records that the patient stated his abdominal pain is worse now than last night. This is an example of pie documentation, SOAP documentation, narrative documentation, charting by exception. The answer is C. Writing subjective data, which includes the information the patient verbalizes, is written in narrative charting. Many computerized documentation systems include standardized care plans or clinical practice guidelines to assist in creation and documentation of nursing plan of care. Each standardized plan facilitates safe and consistent care for an identified problem by describing or listing institutional standards and evidence-based guidelines that are easily accessed and included within a patient's electronic health record. After completing a nursing assessment, the nurse will identify and select the standardized plans that are appropriate for the patient and are to be included in the individualized plan of care. The care plans need to be modified and individualized for the patient, looking at the interventions, goals, and the outcomes. For telephone calls made to a provider, the nurse will document every phone call that is made, and the documentation will include when the call was made, the number that was called, whom made the call, who was called, to whom the information was provided, what information was provided, and what information was received. There are guidelines for telephone and verbal orders. The nurse must clearly identify the patient's name, room number, and diagnosis. The nurse will use clarification questions to avoid misunderstandings. The nurse will document TO for telephone order or VO for verbal order, including the date and time, name of the patient, the complete order, the name and the credentials of the healthcare provider that is giving the orders, as well as the nurse's name and credential, because that is the nurse taking the order. The nurse must read back all orders prescribed to the healthcare provider who gave them and document TORB, telephone order readback, when signing the name and credentials of the nurse. The nurse must follow all the agency policies. Some institutions will require telephone and verbal orders to be reviewed and signed by 2 nurses. Incident reports or occurrence reports are completed whenever an incident occurs. The analysis of the incident reports helps to identify the system and/or the individual human issue where an educational or in-service program or changes in policies and procedures are needed to reduce the risk of future occurrences and harm. Incident reports are part of the quality improvement program. They are not part of the health care record of the patient. Incident reports contain confidential information. Distribution of the incident report is limited to the individuals who are responsible for reviewing the forms. A patient's acuity level that is determined by assessment data that an RN enters into the computer program is based on the type and number of the nursing interventions that are required by that patient within a 24-hour period. Nursing interventions can include IV therapy, wound care, or ambulation assistance. Nursing documentation within the healthcare records provides evidence that supports the assessment of an acuity rating for an individual patient. The acuity level is a classification that compares patients with another group of patients. An acuity system will classify patient from 1, which is independent in all but 1 or 2 aspects of care and almost ready for discharge, to a 5, which is totally dependent in all aspects of care, requiring intensive care. What are some discharge instructions that you would provide to Mrs. Smith? The requirements for documentation in long-term health care facilities are governed by individual state regulations, the Joint Commission, and the Centers for Medicare and Medicaid Services. The Centers for Medicare and Medicaid Services mandate the use of Resident Assessment Instruments, or RAIs, These include the minimum data set and the care area assessment that documents data in long-term care facilities. The minimum data set assessment forms are completed on admission and then periodically within specific guidelines and timeframes for all residents within a certified nursing home. The minimum data set information determine the reimbursement level under the prospective payment system for Medicare Part A residents in skilled nursing care facilities. In the home health care setting, the Medicare system has improved accessibility to information and facilitates interprofessional collaboration. Medicare has specific guidelines to establish eligibility for home care reimbursement. Information used for reimbursement is gathered from documentation of care provided within the home care setting. The documentation is the quality control and the justification for reimbursement from Medicare, Medicaid, or private insurance companies. Information in home health care records includes patient assessment, referral and intake forms, interprofessional plan of care, list of medication, and reports to third-party payers. Nurses document all their services for payment in this record. These services would be direct skilled care, patient teaching, skilled observation, and evaluation visits. Nurses use two data sets to document clinical assessments and care that is provided in the home care setting. OASIS is Outcome and Assessment Information Set is required for all patients ages 18 years and older, with the exceptions of patients that receive prenatal or postnatal care. These patients then are the ones that are receiving skilled care through a home health agency that is reimbursed by Medicare or Medicaid. OASIS includes a comprehensive admission assessment and allows for the calculation of clinical, functional, and service scores that provide justification for reimbursement of services. OMAHA is a research-based, comprehensive, standardized taxonomy or classification that is designed to enhance practice, documentation, and information management. This consists of three components: the problem classification scheme, the intervention scheme, and the problem rating scale for outcomes. This provides a useful model for comprehensive evaluation of the quality of nursing care provided in the home care setting. A patient that you are assisting has fallen in the shower. You must complete an incident report. The purpose of an incident report is to exchange information among healthcare members, provide information about patients from one unit to another, ensure proper care for the patient, aid in the hospital's quality improvement program. The answer is D. Any deviation from the norm, like a patient fall, can be used to improve quality. Incidents are gathered and assessed to see if there is a way to prevent it from happening again. Critical pathway documents facilitate the integration of care because all healthcare team members use the same document to monitor the patient's progress during each shift or in every home care visit. Healthcare information system consists of computer hardware and software that is dedicated to collection, storage, processing, retrieval, and communication of patient care information within a healthcare organization. Clinical information system is a large computerized database management system that is used to access patient data needed to plan, implement, and evaluate care. The Nursing Clinical Information System incorporates the principles of nursing informatics to support the work that nurses do by facilitating documentation of nursing process activities and offering resources for managing nursing care delivery. Clinical Decision Support System is a computerized program that aids and supports clinical decision making. Nurses who specialize in informatics have advanced knowledge in information management and demonstrate proficiency with informatics to support all areas of nursing practice, including quality improvement, research, project management, and system design. Professional organizations like the American Association of Colleges of Nursing, the National League for Nursing, and the Quality and Safety Education for Nursing Institute has recommended that all nurses require a minimum level of awareness and competence in informatics and the use of information technology.